All right. Hello, everybody, and good afternoon. Thank you, everybody, for joining us for our second webinar in our 2024 HARC webinar series. We're really thrilled today to have Katie McGuire-Jack and Heidi Coggins here to share some really exciting research that they did recently with Parents as Teachers programs in Michigan. So I will let them take it away in a minute. But as just some short introductions, Dr. Katie McGuire-Jack is an associate professor of social work at the University of Michigan, and Heidi has over 20 years of early childhood experience, and she is currently a prevention program manager at Children's Trust Michigan. And so I know some people might have to hop off at the hour mark, but we are going to record this entire presentation and we'll have it posted on our website if you need to be able to catch it later. And if you do have to hop off, we will send an evaluation link in your email later today. So we'd love for you to complete our short evaluation. And I think with that, I will turn it over to Katie and Heidi.
Awesome. Thank you so much, Kay. We're really excited to be here. My name is Heidi Coggins. I'm with Children's Trust Michigan, and we are honored to share our project that we did together with Dr. Katie Jack McGuire at U of M School of Social Work. So we are going to share with you today the journey that we took to increasing access to EITC, or Earned Income Tax Credit, to reduce ACEs. Here, this slide just basically shows you the things we're going to talk about and discuss today. So you can see we'll go over some background information first, talk about the intervention description, and then go into the study and the findings. So we're going to cover a little bit of background information first before we get into the study. And I would just like to share with you before we get into the implementation and the evaluation results. Some background about Children's Trust Michigan. We are a state lead for child abuse and neglect here in Michigan, and we're appointed by the governor each year to be that state lead. We fund and support primary prevention, secondary prevention programs across the state that cover all 83 counties. We also have created a statewide family resource center network and currently have 11 family resource centers. Children's Trust Michigan believes that all children can and should have a safe, happy, and healthy childhood. I know many of you are aware and know about the ACEs experiences, but I just want to give a little brief overview of the adverse child experiences. And they were done, as many of you know, in collaboration with Dr. Vincent Valetti and his colleagues. It was one of the first studies to rigorously examine the impact of traumatic events in childhood on adult status. The ACEs study looked at the 3 types of abuse: sexual, physical, and emotional abuse. Also, the 2 types of neglect, physical and emotional, and 5 types of family dysfunction, such as mother treated violently, some substance use, imprisonment, or mental health of household parents and members, and parents separated or divorced. The results revealed that over 12% of the population had more than 4 adverse child experiences. The study also found that a dose-response relationship between ACEs and the negative health and well-being outcomes across a person's lifetime. A dose-response relationship, as you know, is where as the dose or the intensity of the trigger increases, so does the intensity of the maladaptive behavior or the response or the outcomes. For example, a person with exposed to abuse or neglect, the more severe and negative health outcomes will cause numerous organic diseases and behavioral health problems. There's a greater likelihood of experiencing intimate partner violence and greater likelihood of engaging in adolescent risky behaviors, such as sexual activity, or illicit drug use, and early onset of smoking and suicide attempts. And that's just to name a few.
Great, thanks, Heidi. So in addition to talking to you about ACEs, we will be talking to you today about the Earned Income Tax Credit. So this is a tax credit that's available within the United States, and this is considered actually the #1 anti-poverty program that we currently have in the United States. So this is a program that's pretty generous in terms of who is eligible for it. It's a refundable tax credit, which means that after your tax liability is covered, you get a check in the mail or a direct deposit to your checking account for the remaining amount. And this is available to both low and moderate income workers. And in 2023, the maximum amounts that were available for parents with one child was up to $4,000 or $3,995, up to over $7,000 for parents that have 3 or more children. This is a significant influx of money for a family, especially a low-income family. This could be a very significant and meaningful amount of cash. And it's also important to note that you can file back taxes up to 3 years. So if you did not file last year and you were supposed to, and you would have been eligible to receive this, you can apply for back taxes up to 3 years, taking that amount to about $21,000 that you might be able to get. So this is a significant amount of money. This chart just shows how much money you can get for the different, what the ranges of EITC are, what the amount of income that you can earn. And as you can see, in terms of the public benefits in the United States, this is considered to be a pretty generous one. Of course, we would like to see these amounts be higher in terms of how much income you can have, but many of our means tested programs are much lower than this. So this one is considered to be more generous. And we see that for families that have 3 or more children, they can earn up to $7,430 in this refundable tax credit. So if the family has no tax liability at the end of the year, that would be the amount that they would get refunded to them. So EITC, despite being this great program that we think is really important that everybody should know about, it has about 1 in 5 people not receiving the credit who is actually eligible to receive it. So 78% of people in 2016 who were deemed to be possibly eligible for the credit, according to the IRS, received the benefit. And that's actually higher than a lot of different public benefits, but we still think that 1 in 5 people eligible to receive it not receiving it is way too high. So the researchers have looked at what the reasons are for the lack of receipt of EITC among eligible people. And they have found that there's a lack of awareness of the benefit in terms for many different groups of people, that some groups of people have concerns about citizenship or about not having filed your taxes properly in the past. And so concerned about filing them now and getting sort of caught that you messed something up previously. Folks have concerns about stigma surrounding receiving government help or using a tax credit. And finally, a lack of knowledge or motivation in how to sign up for the credit. So why are we talking about EITC and ACEs? I mean, that's a lot of acronyms, but that's not the only reason why we're putting them together. So EITC has been found by research to show a reduction in ACEs and a reduction in things that we consider to be ACEs. So why do we see this connection? EITC has been found to increase work among parents, which is great because that was what it was intended to do. It was intended to make work count more for parents. And so we find in the research that it does do that. When folks have access to earned income tax credit, we see higher levels of work. In terms of how that then relates to things that we consider to be adverse childhood experiences, we know that increasing work for survivors of intimate partner violence can provide a pathway out of that violent relationship. It also reduces poverty, which can provide another pathway out of the intimate partner violence situation because it reduces the reliance that the survivor might have on an abuser. It decreases economic hardships, which in and of themselves are considered to be adverse childhood experiences, and has been shown to reduce parental mental health problems. In terms of the things that we care about the most, of course, we care about all adverse childhood experiences, but Heidi and I are people who have dedicated our careers to child maltreatment prevention. So in terms of child maltreatment prevention specifically, there has been some really great high quality research to suggest that EITC really does have positive impact there. So some research has shown that states that have a refundable state earned income tax credit has lower hospital rates of admissions for abusive head trauma. So this is not child welfare entries. This is actually kids coming to the attention of a hospital because they have abusive head trauma. So when a state has a refundable state earned income tax credit above and beyond the federal credit, we see lower rates of those admissions. Next, we see that receipt of earned income tax credit is associated with lower rates of self-reported child welfare contact and self-reported child maltreatment behaviors. So this is not subject to the decision-making of anybody in terms of a child welfare worker, because this is a parent reporting their own behaviors. So when a parent reports receiving earned income tax credit, we see better outcomes. Next, for states that have an additional earned income tax credit above and beyond the federal benefit, we see a 7.34% reduction in foster care entries. And we know that foster care is a huge expense for states. So this is actually a huge cost savings for states. And we also see that a refundable state earned income tax credit is associated with an 11% decrease in foster care entries. So we see a lot of really positive benefits that would make us think that possibly this could be a pathway. If we can increase parents' take up of earned income tax credit, we might be able to see some improvements for child maltreatment. And as a result of that, the Administration for Children and Families at the federal level, the Office of Minority Health, funded a group of projects to try to increase take up of earned income tax credit in order to reduce ACEs specifically. I'm going to hand it back over to Heidi to talk about our intervention.
Awesome. Thanks, Katie. So the next few slides, we're going to talk about the intervention and what that looks like here. We aim to increase, hold on, I think sorry. Okay, so here we go. So based on research and the positive impact the EITC potentially can have, as Katie had mentioned, on children and families, 3 goals were created. So here you can see the first goal and objective is to increase the economic security, because we saw that benefits families when they do have increased economic security and they have able to increase their finances and they're able to work. So in order to do that, we're hope to increase the awareness of EITC. We want to reduce any barriers that families might have to be receiving the EITC earned income tax credit, and then actually to be able to do the follow through and actually receive those benefits. Because there's a lot of steps that could be involved and it can be overwhelming for families. The second goal and objective is to increase the protective factors. When families receive, oops, hold on a second. My slides are skipping ahead of me. So we aim to increase the protective factors among families, and Children's Trust Michigan funds several parents as teachers, home visiting programs across the state, and therefore we felt that this was just a natural fit in strengthening the family's protective factors. And then just as a reminder, what those protective factors is to improve parental resilience, to increase social connections, increase concrete supports in times of need, improve knowledge of parenting and child development, improve social, emotional, and development of young children. And we know that also there's a direct connection to increasing protective factors, also to mitigating child abuse and neglect. And so this is just a really key factor. And when families are more economic and there's less stress, then we increase their protective factors, we have a higher rate of success in children. Our third objective and goal is to reduce the ACEs, as Katie had mentioned. So we heard a little bit about the ACEs, but when families receive economic security, including strengthening their protective factors, there's a great potential to reduce adverse child experiences as well, as a result of reducing child abuse and neglect. So if we're able to reduce ACEs in the children of the families that are existing, then we're able to reduce child abuse and neglect. And at least that's what we're hoping to. Also including intimate partner violence, improving parental mental health as well. So I want to get into a little bit about what the approach is. And this is the part that probably I start to get a little excited and might get a little winded on. So here you can see we had a 2-tiered approach. And as mentioned earlier, Children's Trust Michigan, we have a primary prevention, or what we call our local councils that provide local services and supports to the general public in their local communities. And then we also fund several secondary prevention programs that provide more of a direct support to families, such as parents as teachers, home visiting programs. We focus on a 2-tier approach. And what that is, you'll see there's a first level approach, which is a public health strategy. And that's where the local councils or the primary prevention folks provided information and materials to partnering agencies in their community, but also potentially to direct families as they might be at community events. And so this is a very broad public approach that they did across the state in select counties. Then we also had that level 2 focus on, level 2 approach was focuses on primary home visiting strategy. Home visitors are a great asset to this approach because they see families on a regular basis and have a relationship with families. As a former home visitor and knowing the positive effects that home visitors can have on families, this was a perfect strategy, especially because Parents as Teachers embeds the protective factors into their curriculum. The Parents as Teachers program would layer the EITC information naturally into their visits. So it wouldn't take away from what the home visitors are already doing, but it would just help elicit some natural conversation around the needs that families might be having around financial status and economic security. And it brings an opportunity for home visitors to be tooled with some of this information that they could share with families at their home visits that they're already doing. Informational materials here, they were created for programs to share with local agencies. And you can see this is an example of one of our flyers. And they were two-sided with some additional information on the back side as well around EITC. But we worked with the Michigan Department of Health and Human Services, the Office of Equity and Minority Health, and the READY office to be sure that these materials were culturally and linguistically tailored to families in the community. And it was really interesting that home visitors were critical in this area and elevated the need to adapt the materials to meet the needs of their families and the cultures they were working with. We worked with an agency, actually it came about that we worked with an agency to have several of the materials translated into the language that home visitors were working with in certain communities, because we want to try to eliminate any barriers, whether it's sharing information and the process to accessing EITC. So we were trying to do what we could, and the home visitors were instrumental in making sure and elevating those barriers as they saw that along the process. Let's see. So here, I want to share a little bit about the EITC Access Program. So not only did we talked a little bit about like what that two-tier approach looked like, but we also want to share that we empowered and gave the home visitors in the treatment group additional training and support. Katie will get more into the design of the study, but I wanted to share what some of the additional supports that the home visitors received before going out to the families before we started this. So in order to start talking about early earned income tax credit, they received a training about earned income tax credit. So they were well versed into explaining that to families who may not either be familiar or may be stuck along the way and what that is and where those resources were and how to file those earned income tax credits. We had some families that actually were able to go back, as Katie had mentioned, 2 and 3 years because they weren't aware of this. And so they took advantage of that, and that was very beneficial. But what we also wanted to equip the families with is to empower them with some financial empowerment. So we had the home visitors go through a training called Your Money, Your Goals. And we did include a link here. It is a really great resource and a lot of information. But the home visitors, as they became comfortable into this tool, they were able to take pieces of that and adapt it to what they're hearing the family's needs might be. So if families have goals around financial, and I know that these are, conversations around the PET curriculum as well to help families be sustainable. If those conversations come up, home visitors are able to have these tools readily available to talk a little bit more about the families about what is their goal, how do they want to get there. And there's some goal sheets within this, Your Money, Your Goals. There's goal opportunities. They talk about banks and different savings accounts and all kinds of accounts. It just really is a great resource to use. And we found that the home visitors really enjoyed this piece of the training that they received, and it was really helpful to families, whether they directly took piece of the EITC, but they were also able just to advance their financial goals and save for a car or save for a house or whatever those might be. But when families are able to get that earned income tax credit, we wanted to be able to be sure that home visitors were ready to talk about what those financial goals were, as if they might be getting a larger sum of money. That how would they utilize that? What would they hope to use that for? And then help kind of guide them through that and empower families to make those decisions. The other thing we trained the home visitors in was motivational interviewing. And that really came about too, because we have a pre and post study that Katie will talk a little bit about. And, we, through those questions there, and then just through the financial, financials isn't always easy, or income tax credit, or why somebody might have a barrier. Those aren't always easy conversations. So we empowered the home visitors with motivational interviewing tools so they could have those difficult conversations and be able to maybe have those conversations that could elicit more information from families and how they could better support them. Now I'm going to turn it over to Katie, and she's going to get a little more into that study design.
Thanks, Heidi. I just want to say really quickly, as Heidi mentioned, this link is on the slide. If you just go to Google and type in "Your Money, Your Goals," it will come up. But as Heidi mentioned, this is a great program, and it's 100% free. The Consumer Finance Bureau will send you little notebooks, spiral notebooks that look really sharp and nice that you can fill out with families if you're interested in this. And this is actually something that a home visitor could just go through the website and teach to themselves. We had a training provided by the Michigan State University Extension Office because they use this tool a lot. So we wanted some training for our home visitors, but this is a tool that anybody could use. So I just wanted to lift that up. We think it's a really great program.
Katie, we also utilized the motivational interviewing. We found some trainings online that were either free or inexpensive to use too, that was beneficial.
Absolutely. Yeah. Thank you, Heidi, for that. Yep. And actually, the earned income tax credit training that we did, we were also able to get for free through the University of Michigan Law School. I reached out to the law school to see if that would be something that we might be able to secure, and they allowed some law students to do it as sort of a senior project. And so they created this training for us. So I'm happy to connect folks to any resources as needed if you just follow up with us. So for this study, we had a quasi-experimental design, which means that we wanted to have a comparison group so that we could make conclusions about what the program did. So in research, there's a couple different designs that you can use. We all have probably heard that a randomized control trial is considered to be the gold standard so that what you're doing really made a difference. They can be difficult and costly to implement. So we did the next best thing, which is a quasi-experimental design where we matched counties with similar demographic characteristics that we're all implementing parents as teachers. And so we had, I'm going to kind of flip back and forth. So we had a treatment group and a comparison group. So we had a couple of counties where they were providing parents as teachers treatment as usual. We love this program. We know that it's an evidence-based program that Children Trust Michigan funds and supports. And we know that families have great outcomes who participate in that program. So we wanted to know, given the great relationship that home visitors have with parents and this rapport that they've established, this engagement that they have, would that be a good way to provide out this level of information where we're talking about some things that can be sensitive in terms of not being able to pay your bills or meet your basic needs? We know that that can be a difficult conversation. But in a lot of my prior work, I have found that when you talk to parents only about child development or only about discipline or parenting and things like that, if this economic concern is something that's going on in their lives, their ability to take in those messages is really much less because they're much more concerned about being able to make rent or being able to put food on the table. And so being someone who is someone trusted with the family, we think that a home visitor would be a great person to have those conversations. So we had the comparison group doing the standard Parents as Teachers program. We had them not change anything. We said, if you're already talking to them about finances, continue doing that. If that was something you were already doing, don't change anything. But for the treatment group, as Heidi mentioned, we gave those additional trainings. And so this group was provided with the tools in their toolbox to be able to talk to parents about their different concerns they might have economically. Did you know you might be eligible for this tax credit? Did you know that there are these strategies available to you that might help you decide if you can't pay all your bills, which ones to prioritize, or if you have a financial goal, some steps that you might be able to take to get to that. So we provided the treatment group with those trainings, and then the comparison group did parents as teachers treatment as usual. We did not have a standardized curriculum where we said, okay, in week 1, talk to them about these pages of the manual, and in week 2, talk about these pages. We had it much more informal, where it was another tool in the toolbox to ask them to start these conversations with parents and then have these tools available. So we had pre and post surveys with this quasi-experimental design. So when parents became engaged with the program, we had them complete a survey, and then they completed a post-test survey 6 months later. So for these surveys, we asked them about their knowledge, application for, and receipt of earned income tax credit. We assessed something called child abuse potential. You may be familiar with this measure, the brief child abuse potential inventory. We asked them about child neglect, intimate partner violence, parental mental health, and economic hardship. And protective factors, that should be on the screen as well. We did assess protective factors, I apologize. So this map shows you the state of Michigan, and we have these 2 control group counties that were down here. We had Kalamazoo County and Washtenaw County served as comparison group counties, where they provided parents as teachers standard. And then the blue dots are the different treatment group counties. And we had 7 treatment group counties. So we had 7 counties where they were providing parents as teachers with the additional tools, and then 2 counties where they were providing just standard parents as teachers. The local councils that you see on this map, that refers to what Heidi was talking about previously with the level 1, where we were doing the public education strategy. That one, I'm not going to be covering the findings of that today because we're on the Applied Home Visiting Research Collaborative. And so I'm only focusing on the results from the home visiting research. But if anyone's interested in hearing more about that, I'd be happy to talk about it. The very short version of it is that the home visiting strategy was much more successful. So what did we find? So this slide just shows you some demographic information. We were trying to understand whether the comparison group that we tried to get really is comparable in terms of the characteristics that we see of the sample. Anything that is statistically significant difference will have an asterisk next to it. So you can see that for gender, we did not have any non-binary parents within the sample. We had only female and male identifying parents, but we did not have any statistically significant differences between female identifying parents or male identifying parents between the 2 groups, treatment and control. In terms of race ethnicity, I'm not sure how well you can see this, but white and black, we didn't have any statistically significant differences, even though the graph kind of makes it look like there are stark differences. Where we did have statistically significant differences was in our Hispanic population, apologies. We had many more Hispanic families or Latino families in the control group compared to in the treatment group. And we had many more Asian families in the treatment group compared to the control group. This was not by design. This wasn't something that we were trying for. It just ended up that in our comparison group, we had 2 Spanish-speaking home visitors. So we ended up having more Latino families within the control group. And then in our treatment group, we had 1 very prolific home visitor who served Burmese families. And so we had a much higher population of Asian American families within the treatment group. So that's something that, you know, we would like to control for if we're able to do some advanced statistical analyses. I will talk about some of the limitations there when I get to that point. In terms of education level, the only statistically significant difference was the group that was more lower education. So we see, although the high school education or equivalent looks different, it's not statistically significant, the difference between treatment and control, and the rest of them all look pretty similar. But for those who did not complete high school, we had a much larger population within the treatment group, about 27.5% compared to 14% in the control group. So we did have a much larger population of those with somewhat lower education. And then in terms of relationship status and number of children, there were no statistically significant differences between the treatment and control group. So that's the background information that is probably less interesting to you. What you probably care more about is what we actually found and whether we made a difference. So in this table, this is the information regarding whether we changed anything in terms of their knowledge regarding EITC. Now, I mentioned that I'll talk about limitations, and I want to talk about that right now. If you look at our ends, so our treatment group, this is the number of people that we have pre and post tests matching for, which is 69 people. And then the control group, there were 51 people. This is much smaller than we had hoped for. We were hoping for around 400 people, and we ended up with around 100 people. This was, well, I'll talk at the end about lessons learned, but this was due in part to COVID-19. So we started implementing this program. We received funding in October of 2020, which was not a great time to be receiving funding to do an intervention happening within people's homes. So many of the home visits were happening virtually, which we know, at least in our state, did not reach as many people as we had hoped. And so the number of people taking this up was smaller than we had hoped. So that precludes us from being able to do some pretty advanced statistics where we could control for the differences in the racial backgrounds and things like that. So we have to stick to some pretty simplistic statistical analyses. So I want to give that caveat. However, luckily, we still had some significant findings that we're very excited about. We were very concerned that even if there was an impact, we wouldn't be able to see it because of sample size issues. But luckily, there was enough of an impact that we were able to detect it. So you can see the asterisks over here in the left-hand column for the first 3 variables. So within the treatment group, about 35% more people reported hearing about EITC at the end of the program compared to the beginning of the program. So we had a difference of about 35%, and that was statistically significant difference. So a lot more people reported, yep, I've heard of earned income tax credit, which is what we hoped because we told the home visitors to talk to them about earned income tax credit. If you compare that to the comparison group over here in blue, there's no significant difference between the 2 time points. It looks like a slight reduction, but it's not statistically significant. You can see here the p-value is 0.62. And in order for something to be significant, we'd be looking for less than 0.05. So you can see here for all of these in the comparison group, nothing was significant. So there was no real change in having heard about earned income tax credit in the control group, which is what we would expect because we didn't tell the home visitors to talk to their clients about earned income tax credits, and we asked them not to change anything that they had previously done. In terms of filing for earned income tax credit, we also had a statistically significant improvement there with a 16% change in the number of people having filed for earned income tax credit. And again, no difference for the comparison group. And then people reporting that they actually received it, there was an improvement there of 20%, which was again statistically significant. So we definitely saw some changes within the treatment group in terms of hearing about it, trying to receive it, and reporting that they received it. We did not see changes in barriers experienced in applying for it that were statistically significant. So in some ways, that's a good thing. We had hoped that we would help reduce the barriers. Excuse me, my fingers are getting a little excited. We hoped that we would see a reduction in the barriers experienced because the home visitor was giving them the phone number for VITA, which is the Volunteer Income Tax Assistant Preparation, which is free tax prep for low-income people. And the home visitor was trained to help them make an appointment and drive them to the appointment if they needed to be driven to the appointment. So we hoped that we would reduce some barriers, but we didn't see a change there. So this is the graphical depiction of what I just told you. Sometimes it's easier to see things in a picture if you don't like looking at a whole mess of numbers all at once. You can see yellow is it at post-test or at time 2, and blue is at the pre-test. And you can see all of these things that we wanted to go up. The first 3 items all went up, and those are all statistically significant. This is the treatment group. And then for the control group, you can see that they mostly stayed the same, which is what we would anticipate to happen. But this is a really important reason why you want to have a comparison group, because we're able to say, okay, there are some differences in the samples, but by and large, the difference between these folks and these folks is that someone talked to them about EITC. If we didn't have a comparison group and we only did pre-post for everybody and everybody was talked to about EITC, we might think, oh, it probably was because the home visitor talked to them. But we couldn't rule out other things. Like, what if there were a bunch of commercials about earned income tax credit, or because the Biden administration passed child tax credits at the same time, maybe people were just more aware of tax credits. So this, because we have the comparison group, allows us to feel pretty confident that the intervention or the treatment made a difference. Moving along. So this slide shows you the difference in the adverse childhood experiences. And again, yellow is the treatment group and blue is the comparison group. Now, the thing that made my holiday for this year, that made me very, very excited to run these statistics right before I went home for the winter holidays was, I'm so sorry. I got a new mouse and I'm not used to it yet. It's like a fancy one. So we see this neglect finding. So we know that child neglect in the United States is a very significant issue, right? More than half of the cases, actually close to 3/4 of the cases that are reported to Child Protective Services are due to child neglect. So this is a big problem, one that we don't have a lot of great programs targeting neglect specifically. We have a lot of evidence-based programs that are really targeting child abuse, where we're looking at parental expectations of their children, the warmth between parent and child, the discipline tactics that you use. But the research about how to intervene on child neglect is behind compared to the research on child abuse. So we were really excited about the potential of this project to make movement on child neglect, because we were trying to increase the economic security of families and put more resources in their pockets. We know that child neglect is highly correlated with poverty, and that parents who are unable to meet their child's basic needs are much more likely to get entangled into the child welfare system for reasons of neglect. So this measure of neglect is parents' self-reported neglectful behaviors. It comes from the conflict tactic scale, parent-to-child version, subscale on neglect. And so it's 5 questions asking about different scenarios that happened in the past year. So we're really excited to see that it went from about 2.5 neglectful behaviors occurring in the past year to less than 1/2 of an event over the past year. This is something that I consider, so it is statistically significant. The program tells you it's statistically significant, but this is also something, as someone who teaches program evaluation and has been evaluating child maltreatment prevention programs for a long time, is a clinically significant movement. We see that number go from 2.46 to 0.42. That's a significant change in that number that we're very excited about. And this is despite having a small sample size, less than we had hoped, but home visitors, working really hard who were actually working on this project. So we did see that clinically and statistically significant improvement on neglect, with neglect going down at post-test in the treatment group only. There was not a statistically significant improvement within the control group. So that suggests to us, we can't conclude it because it's not a randomized control trial and because these are some pretty basic statistics using t-tests. But it suggests to us that the program may have made a significant impact on neglect, which is something that is just very exciting. We did see, so in all transparency, within the control group, we saw improvements for parents in terms of depression and anxiety that were statistically significant, and we did not see corresponding changes within the treatment group. We did not have statistically significant changes on depression and anxiety in the treatment group, but we did see them in the control group. We're not sure exactly why that might be. Again, talking about the clinical versus statistical significance, you can see that it is statistically significant change between time 1 and time 2. But if you look at the magnitude of the change is smaller compared to the change on the neglect scale. So it may not be as clinically significant in terms of an improvement. And we're not exactly sure why we would see that in the control group, but not in the treatment group. That's something we need to investigate more with a larger sample size. And after adjusting for different characteristics of families that were different between treatment and control, we would be curious to know if those things still hold. Similar story for the protective factors, where we see small but statistically significant improvements for the comparison group and no statistically significant improvements for the treatment group. And so I'm not going to bore you with the exact same story that I just told you about depression and anxiety, but we do see that the magnitude of the difference is about 0.3 for all 3 of these protective factors. So the difference between clinical significance and statistical significance is an important consideration here. And then we don't really know what to conclude about that. We don't see significant declines for the treatment group, but we don't see the same statistically significant improvements. We think that it could be a fluke because both groups are still providing parents as teachers, and it's not the case that the treatment group is watering down what they're providing and providing a lot more on financial and not as much on parents as teachers. They're providing the same level of parents as teachers, just with some additional things. So we're not quite sure on that. That's something that we want to investigate further in additional research with a larger sample. All right, so what did we learn? So we learned a lot of lessons. The most significant issue for us in delivering this program was delivering it during COVID-19 at the height of the pandemic. That was a very significant, difficult issue for us. So as I mentioned, we received funding in October of 2020. And so what that meant was, as we were trying to engage these parents as teachers programs across the state of Michigan, all of those meetings happened on Zoom. Of course, we're meeting on Zoom right now, and we're very used to that at this point. But in October of 2020, that was still a relatively difficult thing. As someone who's worked in this field for a very long time, prior to this intervention, what we would have done is shown up to meet with home visitors and supervisors with coffee and donuts and tried to build rapport and talk to them about why we think this is important and spend time having that human connection. In Zoom world, right, you have your like 60 minutes together and you're trying to move on to the next thing. And so building rapport was much more difficult. So trying to get buy-in from home visitors was harder. So that was sort of that's sort of the backdrop to the lessons learned. However, the findings are very suggestive that financial empowerment and benefits information may be a very powerful addition to evidence-based home visiting programs. We think that there's something very special about the relationship between a home visitor and a parent that may allow for these sometimes difficult conversations to happen where you might be embarrassed to talk to other people about it. But if this is someone who's been in your home and you've met with weekly and they know you maybe better than some other people, this might be someone that if they introduce the topic, you might feel comfortable talking about it. Because we had significant improvements within the home visiting strategy and not within the public education strategy, we think that there's something really special about that one-on-one interaction between parents and home visitors. Our second is that, again, beginning a new intervention during COVID-19 was hard. A lot of our home visitors were experiencing burnout and experiencing challenges within their own families. Parents or home visitors were experiencing deaths within their own families or within their own communities, different communities being hit disproportionately. And so trying to roll out something brand new and adding to people's workload was difficult. And something that we hadn't considered or anticipated when we were applying for this. I think we applied for it when we thought COVID-19 was going to be like a 2-week thing, and then we were all going to move on with our lives. And by the time the money came through, we realized that was very wrong. So that was hard. and figuring out how to provide incentives to home visitors, provide them with additional pay if you're going to be asking them to be doing additional work, we think might be a positive strategy. And then the third lesson that I want to talk about is that we did a lot of rapport building and engagement with supervisors from home visiting programs to get them excited about the program and get them to opt in or opt out. So we worked with the supervisors primarily at that stage. And then when supervisors opted in, we began building rapport and trying to engage home visitors. But basically, it was a little bit of a top-down approach with supervisors, if they opted in, telling their home visitors, we're doing this, so let's get trained. And so we think that in future iterations of this, we would like to start with home visitors first and or at the same time as supervisors, so that we can really get that buy-in from them first, as opposed to them being instructed that they must do something new that's going to require more time. And then we also think that that inhibited the transfer of knowledge when we were communicating with supervisors and the information possibly not trickling down where it needed to trickle down to. Those are the lessons learned. In terms of next steps, we would love to pilot this program again with a larger sample, pilot it in different places. If there are other states that would be interested in doing something like this, we're happy to share any of the training materials or link you to the different websites that we use, and happy to answer any questions that folks might have. So just thank you very much for your time. That's all I have for the presentation. Oh, and my contact information and Heidi's is up here. We can also put it in the chat. Please feel free to reach out if you have any questions to either Heidi or I.
Thank you both so much. Looks like we have a great turnout. So are there any questions we can take for Katie or Heidi?
Hey, I have a question.
Yes.
I'm sorry, I moved my screen up here, but I'm going to try to look at my camera. First of all, thank you so much. That was a fantastic presentation. I learned so much. It was so clear. One question I had, well, a clarifying question first, and I apologize if I missed it. What was the amount of time between the pre-test and the post-test? So how much time was this intervention going? And then my second question is, you mentioned early that there were sort of three core components to the intervention. There was the financial empowerment training, the motivational interviewing, and then the information about the earned income tax credit. And I was curious if you were able to collect any data or if you just heard anything anecdotally around, whether, one or more of those components seem to be driving the change, or do you have any sense of that, or was it a combination of the three? I'd just be curious to hear your thoughts. Thanks.
Sure. Yeah, I'd be happy to go first, and Heidi, feel free to jump in. So the answer to your first question is there were 6 months from pre-test to post-test. Families are served much longer than that because they can stay in the program. Heidi, is it until the child is age 5, or at least one child in the home is age 5? Is that correct?
Yeah, depending on the parents as teachers and where they're trained as birth to 3 or birth to 5. Mm-hmm.
Okay,
yeah,
so they stay in the program
for years.
Yeah, they stay in longer than 6 months. We did the pre and post test across 6 months so that we'd have the same amount of time for everybody. We did collect or try to collect data every 6 months for families over the three years of the intervention that we had ongoing. We were not very successful in that. So the reason why we did that was because we were worried if 6 months pass and a tax time hasn't happened in those 6 months, we might miss people who are going to apply for it next month. And so we instituted at the beginning, like every 6 months, we will survey them so that we can capture that. But the attrition over time was so poor that we really weren't able to use any of the data other than that first post test. So we opted to go with that first post test just so that we had the same time frame for everybody. Collecting data was one of the most difficult parts about the home visitor buy-in, I would say. Our original strategy was to have the home visitors collect these surveys from parents at the home visits on iPads. And that ended up being a huge barrier for our home visitors. They just didn't have the time or ability to do that. And so it ended up that the University of Michigan research assistants took over that and called parents and conducted surveys themselves. So if we had done that from the beginning, we may have had a little better ability to do that every 6 months. But that was a change we made, kind of shifting gears halfway through, realizing our numbers are not where they need to be. So that's the answer to your first question. In terms of the second question, our quantitative numbers are not able to speak to that. So future iterations of this, we would love to be able to have different implementations where the one group might get just the your money, your goals, one might get just EITC, whatever, and compare them. We're not able to do that because it was just a suite of an intervention. So our quantitative data doesn't speak to it. However, our qualitative data, which we did not present on today, so we did conduct interviews with both home visitors, supervisors, I said both, but all three, supervisors, home visitors, and parents. We did talk to all of those groups to hear about what their experience was like doing the program, receiving it, or providing it. And what we found from those qualitative interviews was a lot of folks talking about your money, your goals. So if I had to suspect about what was the most useful for families, I would suspect it's your money, your goals. It's a really great program. It's a lot of information, so it's really great for a home visitor to provide it to a parent. It's intended for people to be able to go through it themselves, but I think it would be completely overwhelming to me to go to that website and try to download tools and look these things up. But if I had someone working with me that could a little bit at a time talk through the different tools, I think it would be much more useful. So when parents talked in the interviews about what was helpful to them, many of them mentioned, this helped me have honest conversations with my partner about how much money we have coming into the home and where it's going. Or this helped me help my child set up a savings account so they can learn how to save money and learn about how these things worked. So a lot of it, there were some folks that talked about the infusion of cash from earned income tax credit and how they were able to pay different things off or celebrate with their child. But the majority of people, when they talked about the financial aspects, was about your money, your goals.
Katie, I would just like to add really quick around that from a home visitor's perspective too, what I heard in meetings and things like that, that I thought it was interesting, the unique approach that some of the home visitors use that tool to adapt to the needs of their families. So knowing it was a lot of information, some of them kind of took that information, created one-pagers, or would just pull out the context and share it with families and say, what part does interest you? And kind of, they really did a great job in starting where the family was, and, because families were at all different stages on financial needs or empowerment. And so they did a really good job in just really gauging where their families were and presenting that information that would be helpful to them.
Anne, yes.
Yeah. Hi. Thanks so much. It's so important that we focus on family economic well-being, and so what a timely seminar. I have a question. Did you consider doing analyses where you used the baseline value for each of your outcome variables as a moderator to see whether or not the intervention was more or less effective for certain subsets of the families?
That's a great idea. Not something that we have done yet. So we've only looked at the basic outcomes using t-tests, but I think that's a great idea. And that might help us to disentangle some of the confusing findings that we have within the comparison group where we see some improvements. I'm wondering, in particular, we have the large group of Latina families that are in the comparison group, and we see the improvements in ACEs and different things for that population. I'm wondering if we might see, if we looked at that population specifically and ran the analysis to see if we might, if that might be driving the difference. And then we could do something similar in terms of the outcomes. Are there certain groups like parents who are experiencing at pre-test higher levels of neglect? Are they more likely to apply for EITC after taking part in this program, or any variety of things. I think those are great suggestions. We are limited in our sample size because of how many folks we have, but that is something that I would love to be able to do in the future. We originally had planned on looking at urban and rural differences, because we specifically selected counties in our original iteration for the treatment and control. We wanted to have comparison and treatment group counties in both rural and urban areas. We ended up not having as much take up as we had hoped among home visiting programs. So both of the comparison counties are urban in nature. We were hoping to be able to do things like that. Like, does this home visiting approach work just as well in rural areas compared to urban areas where they may have less access to the VITA volunteers, for example? Actually, COVID-19 put most of the VITA appointments on Zoom. So that became less of an access issue within the rural counties, and as long as they had internet access, which is a big question mark in some of our rural communities. But yeah, I think that's a great idea, Anne. Thank you for the suggestion. I'd be happy to send you a copy of the flyer. It has Michigan specific information, but you could use it for like, you could use it if you wanted to make changes and update it. Oh, you're in Michigan. Okay, then you're good. So we can provide you with that information. If you just send me an email, I can update it. We haven't used it since last year, so it has last year's tax information on it, but we can update it. Just has a couple things that change year to year, like the maximum amount of money you can get. But I can send that to you. And if anyone else is interested in it, I'd be happy to send you the document that you can update for your own state if you're not located in Michigan.
We just have a few HARC announcements that we would love to share as we wrap it up.
All right, so this was a great presentation. Thank you so much. And thanks to the folks that joined us. If you could complete our brief webinar evaluation survey before the end of this, we'd greatly appreciate it. Also, we encourage everyone to become a HARC member by joining our practice-based research network, and it's open to anyone who's interested in home visiting. So anyone on this call, we encourage to join us. There's a lot of benefits to joining, including proposing or participating in research studies, receiving our newsletter, attending our free annual conference, and these webinars, of course. So if you want to scan that QR code, that would be great. We hope you'll save the date for our 9th annual meeting to be held September 17th through 18th in Washington, D.C. We'll have more information on that on our website and in our newsletter. And finally, we always like to hear from our members regarding the work that we are doing. And right now we are working on developing materials to help our members understand and use the precision paradigm. If you'd like to share your opinion, we'd love to hear from you. The survey takes 3 minutes, and just scan the QR code. And with that, I'll leave it to Kay.
All right. Well, we just wanted to do a final thank you. Thank you so much, Katie and Heidi, for spending your afternoon with us and sharing this really great information. And again, we'll have it recorded and posted on the website if you wanted to refer back to it. And we will be announcing the date and topic of our April webinar very shortly. So we hope you will join us for that. Thank you, everybody.